Many of my patients over 60 diligently add blueberries to their daily diet, believing they are doing the absolute best for their brain and their heart. They are correct that blueberries are powerful, but here is the frustrating problem. Many of them are unknowingly neutralizing the benefits of these berries by pairing them with other common, healthy foods. An innocent breakfast bowl or a morning smoothie can, from a biochemical standpoint, become a completely wasted effort. The wrong combination can block the absorption of those critical antioxidants you seek, or in some cases, even trigger significant digestive distress. Understanding what not to pair with this powerful fruit is, in my clinical opinion, just as critical as the decision to eat it in the first place. My name is Brian Caldwell. I have been a physician specializing in geriatric care for over 35 years. My work is dedicated to helping patients navigate the unique health challenges of aging, focusing on vitality and longevity through smart, evidence-based choices, not just expensive prescriptions. We believe here that smart food choices are the foundation of strength after 60. If you are ready to take control of your health, I invite you to join our community. If you find this information valuable, please consider liking the video, and I encourage you to leave a comment with your own questions or experiences. Your interaction helps others who may have the same concerns. And if this is your first time here, please subscribe so we can continue this healing journey together. Today, we are taking a deep dive into how to truly maximize the immense power of blueberries. More importantly, we're pulling back the curtain on 3 crucial foods you should absolutely never pair them with. The number one worst food to avoid is something most of my senior patients eat every single morning, and it is vital you know about it. Before we discuss the combinations, we must first establish exactly why we are having this conversation. What makes this small berry so uniquely protective, especially for the aging population I work with? The answer lies in its deep, rich color. This color comes from a class of compounds called anthocyanins. These are not just simple antioxidants. They are potent anti-inflammatory agents. Their true power, and the reason they are so heavily studied for brain health, is their unique ability to cross the blood-brain barrier. This is a highly selective, protective membrane that shields your brain from many substances in your blood. But anthocyanins can get through. Once inside, they perform a critical job. They neutralize what we call oxidative stress. In my clinic, I often describe oxidative stress as a form of biological rust. It is the natural, unavoidable byproduct of your cells metabolizing oxygen to create energy. Over 6, 7, or 8 decades, this rust and the low-grade chronic inflammation it causes begin to accumulate. This is the underlying process that can damage our neurons, the brain cells responsible for thought and memory. This damage is a known contributor to the pathway of neurodegenerative conditions, from mild cognitive impairment, what many call brain fog or senior moments, to the devastating diagnoses of Alzheimer's and Parkinson's disease. The anthocyanins in blueberries act as a direct line of defense within the brain tissue itself, helping to quench this inflammation, preserve healthy neural pathways, and improve the communication or signaling between brain cells. This isn't just about preventing disease. It is about maintaining mental clarity and emotional balance as we age. This protective mechanism is not limited to the brain. It extends to our entire cardiovascular system. The same oxidative stress and inflammation that damage brain cells also attack the delicate inner lining of our blood vessels, a lining called the endothelium. In geriatric medicine, we consider the health of the endothelium to be a primary indicator of overall cardiovascular risk. A healthy, flexible endothelium is responsible for releasing a critical molecule called nitric oxide, which instructs the blood vessels to relax and widen, promoting healthy blood flow and regulating blood pressure. When this lining becomes stiff, damaged, and inflamed, a condition we call endothelial dysfunction, it loses this ability. This is the very first step in the development of atherosclerosis, or the hardening of the arteries. The antioxidants in blueberries have been shown in clinical studies to directly support this endothelial function, helping to keep our arteries flexible and responsive. This is also why they are so crucial for heart health. Many of my patients are rightly concerned about their cholesterol levels, but it is a specific type of cholesterol that poses the greatest threat. The real danger begins when our LDL, or bad cholesterol, becomes oxidized. An oxidized LDL particle is highly inflammatory and is the seed that begins to form plaques in the artery wall. The flavonoids and other compounds in blueberries are powerful inhibitors of this LDL oxidation. This is a profound benefit. Research has indicated that a modest, consistent daily intake, a generous handful, perhaps around 30 or so berries, can reduce the risk of cardiovascular events by as much as 15%. This brings us to another critical concern for aging: blood sugar management. As we age, our cells can become less responsive to the hormone insulin. This is called insulin resistance, and it is the precursor to type 2 diabetes and metabolic syndrome. This is where blueberries shine once again. They have a glycemic index, or GI, of around 53, which is considered low to medium. This means they do not cause a sudden, sharp spike in blood sugar after eating them. The reason for this is their high content of soluble fiber. This type of fiber dissolves in water to form a gel-like substance in your digestive tract. This gel dramatically slows down gastric emptying, the rate at which food leaves your stomach and its sugars are absorbed into your bloodstream. This slow, steady release of glucose prevents that dangerous spike, puts far less stress on your pancreas, and over time can genuinely improve your body's overall sensitivity to insulin. This vascular protection also extends to the most delicate blood vessels in our body, those in our eyes. The microcapillaries that feed our retina are often the first to show signs of systemic damage. Conditions that I see frequently, such as macular degeneration, glaucoma, and cataracts, are all linked to a combination of oxidative stress, often from UV light, and poor microcirculation. The unique blend of anthocyanins, vitamin E, and carotenoids in blueberries acts as a form of internal protection, helping to filter harmful light and bolster the integrity of these tiny blood vessels. Finally, we see this benefit in our skin. In my practice, skin is not a cosmetic concern. It is a vital organ. As we age, skin becomes thinner and more fragile, and wound healing slows down. This can lead to serious complications, from chronic ulcers to infections. Blueberries are exceptionally rich in vitamin C, which is a non-negotiable cofactor for the production of collagen. Collagen is the protein matrix that gives skin its strength and structure. By supporting collagen synthesis, the nutrients in blueberries help maintain skin integrity, keeping it more resilient and better able to perform its primary job: protecting you. Now that we have established this remarkable whole-body catalog of benefits, protecting our brain, our heart, our blood vessels, our blood sugar, and our skin, we must confront the frustrating truth I mentioned at the beginning. All of these benefits, particularly those from the antioxidants, can be completely blocked by common, seemingly healthy food choices. This is the critical information I find so many of my patients are missing. This is not a matter of taste, it is a matter of biochemistry. The number one food you should never pair with blueberries, the one I see in my patients' breakfast bowls almost every single morning, is cow's milk. This is often a complete shock to my patients. A bowl of oatmeal or whole grain cereal, topped with a generous handful of fresh blueberries, and then covered in milk, seems like the perfect heart-healthy start to the day. Unfortunately, from a chemical standpoint, this combination is a failure. The issue lies with the proteins in cow's milk, specifically a protein called casein. Casein has a very strong binding affinity for polyphenols, which is the family of compounds that includes the anthocyanins we've been discussing. When you pour milk over your blueberries, the casein proteins essentially latch on to these delicate antioxidants, forming an insoluble complex right in your bowl. Your digestive system cannot break this bond. Your body is unable to absorb this complex. As a direct and unfortunate consequence, those precious brain and heart protecting compounds are not absorbed into your bloodstream. They pass straight through your system, completely neutralized. You will still get the fiber and some of the vitamins from the berries, but the primary powerful antioxidant benefit you were seeking is, from a biochemical perspective, completely lost. The effort is wasted. To be perfectly clear, this does not make milk a bad food. For those who tolerate it, it is a significant source of calcium, vitamin D, and high-quality protein, which are all essential. However, it is an antagonistic partner for blueberries and, in fact, for most antioxidant-rich teas and fruits. The solution is separation. If you enjoy blueberries in your morning oatmeal, I strongly advise my patients to make that oatmeal with water, or with a plant-based milk, alternative like unsweetened almond, oat, or soy milk, as these do not contain casein and will not interfere with absorption. If you wish to drink cow's milk, I recommend consuming it at a different time of day, ideally maintaining a 2 to 3 hour window between your blueberry intake and your dairy intake. The second food you should avoid pairing with blueberries is another health food staple, one that is very common in detox drinks and green smoothies. Cucumber. This is another combination that seems perfectly healthy, as both are hydrating and refreshing. The problem here is not a protein, but a specific enzyme contained in raw cucumber. This enzyme is called ascorbate oxidase, also known as ascorbatase. The entire function of this enzyme, its only job, is to actively and efficiently break down and destroy vitamin C. As we discussed, blueberries are an excellent source of vitamin C, which is critical for your immune system and for collagen production. When you put raw cucumber and fresh blueberries into a blender together, you are rupturing the cell walls of the cucumber and releasing this potent enzyme. You are, in effect, mixing an anti-vitamin C with your vitamin C-rich fruit. The ascorbate oxidase begins to degrade and neutralize the vitamin C immediately, before it even reaches your stomach, let alone your bloodstream. You are taking two very healthy foods and, by combining them, creating a beverage that is nutritionally inferior to what you would get by eating them separately. It's an act of unwitting nutritional sabotage. An important and verifiable note here is that this specific enzyme, ascorbate oxidase, is heat labile. This means it is destroyed by heat. Therefore, eating a blueberry dessert after a dinner that included cooked cucumber would pose no issue at all. The problem lies specifically in the raw combination, which is most common in smoothies and fruit salads. To be safe, consume them at least 30 minutes apart. The third food combination I caution my patients about is pineapple with blueberries. This is a very common pairing in fruit bowls. Unlike the first two, this combination doesn't necessarily destroy the nutrients. Instead, it can create significant digestive distress, and this is a major issue I see in my geriatric practice. The problem stems from the high combined acidic load. Both pineapple and blueberries are acidic fruits. When consumed together, they can create a significant increase in stomach acid production. For many individuals, this is not a problem, but for many of my patients over 60, the lower esophageal sphincter, or LES, has weakened with age. This is the muscular valve that is supposed to keep stomach acid in the stomach and out of the esophagus. When this valve is weak, a large acid load from a pineapple blueberry fruit salad can easily overwhelm it, forcing acid up into the esophagus and causing the painful symptoms of GERD, or acid reflux. This can manifest as bloating, nausea, or that classic burning in the chest. Pineapple also contains a unique enzyme called bromelain. While bromelain has its own anti-inflammatory benefits, it is also a protein-digesting enzyme, which can be an additional irritant to a sensitive stomach lining or a pre-existing ulcer. My clinical advice is simple. Enjoy both of these wonderful fruits, but do not eat them in the same sitting. Consuming them at least an hour apart provides your digestive system with ample time to efficiently process the acids from one fruit before it is introduced to the acids of the other. We have now navigated the pitfalls. We understand what to avoid to prevent neutralizing the benefits or causing discomfort. Let us now turn to the positive, to the intelligent food pairings that do the opposite. These are the synergistic combinations that can actually amplify the power of blueberries, turning a healthy snack into a high-performance nutritional tool for healthy aging. The first and perhaps best food to pair with blueberries is plain, unsweetened Greek yogurt. This immediately raises a question. Dr. Caldwell, you just spent 5 minutes telling me to avoid dairy. This is a crucial distinction, and it highlights the magic of fermentation. Greek yogurt is not the same as fluid milk. The fermentation process, the work of those beneficial, live bacterial cultures, fundamentally changes the food. The probiotics in the yogurt pre-digest and alter the very structure of the milk proteins, including the casein. Because of this alteration, they are far less likely to bind to and block the antioxidants from the blueberries. In fact, they do the opposite. By consuming blueberries with a probiotic-rich food, you are supporting your gut microbiome. In my field, we are now beginning to understand that a healthy gut is the foundation of all health, especially brain health. There is a direct pathway of communication between your gut and your brain, known as the gut-brain axis. A healthy, well-balanced gut microbiome helps reduce systemic inflammation and sends calming signals to the brain. So, by combining these two, you are getting the brain-protecting compounds directly from the blueberries, and you are supporting your brain indirectly by nourishing your gut. Furthermore, Greek yogurt is exceptionally high in quality protein. For my older patients, this is a vital clinical objective. We are in a constant battle against sarcopenia, or age-related muscle loss. This loss of muscle is a primary predictor of falls, frailty, and a loss of independence. The high protein content in Greek yogurt is a powerful tool to help maintain that lean muscle mass. This combination truly supports your brain, your gut, and your muscles. Our second synergistic food is the humble banana. A banana blueberry smoothie, made with water or a plant-based milk, of course, is an excellent choice. The banana is rich in potassium, a mineral that is essential for regulating blood pressure. This works in perfect harmony with the blueberry's endothelial supporting benefits, creating a dual action benefit for your entire cardiovascular system. But the real synergy comes from its fiber. Bananas are rich in a soluble fiber called pectin, and also in fructooligosaccharides. These fibers act as prebiotics. A prebiotic is, quite simply, food for the probiotic bacteria we just discussed from the Greek yogurt. This allows me to give my patients a power trio recommendation. A bowl of Greek yogurt, the probiotic, topped with a sliced banana, the prebiotic, and a handful of fresh blueberries, the antioxidant. This is a truly functional food combination that supports digestion, stabilizes energy, and floods your system with protective compounds. Our third and final powerhouse pairing is walnuts, or a high-quality mix of nuts. This is perhaps the most potent combination for both brain and heart health. Walnuts are one of the very best plant-based sources of an omega-3 fatty acid called alpha-linolenic acid, or ALA. Your brain is composed of nearly 60% fat, and it requires these essential fatty acids to build and repair cell membranes. ALA is a direct precursor to DHA, which is a primary structural fat in the brain. When you combine walnuts and blueberries, you are, in essence, providing the building blocks for your brain's structure, the ALA from the walnuts, and the protective shield for that structure, the anthocyanins from the blueberries. This is a remarkable defensive strategy for long-term cognitive function. There is another level of synergy here as well. The vitamins in blueberries are a mix of water-soluble, like vitamin C, and fat-soluble, like vitamin E and vitamin K. In order for your body to absorb fat-soluble vitamins, they must be consumed with dietary fat. The healthy monounsaturated fats in the walnuts and other nuts provide the necessary vehicle for your body to absorb these crucial vitamins from the berries, ensuring you get the full nutritional spectrum. A final, practical word. While fresh blueberries are wonderful, I assure my patients that frozen blueberries are an outstanding and equally beneficial substitute. They are often flash frozen at the peak of ripeness, which perfectly preserves their nutrient content, and they are available and affordable year-round. They can be tossed directly into a smoothie or stirred into hot oatmeal. However, a few critical medical considerations are necessary, especially for my patients who are managing other health conditions. Although infrequent, allergic reactions to blueberries can occur, presenting as itching, rashes, or difficulty breathing. If this happens, seek medical attention. More commonly, I must advise my patients who are on anticoagulant medications, blood thinners like warfarin or Coumadin. Blueberries contain vitamin K, which is essential for blood clotting. Your doctor is managing your medication based on a blood test called an INR. The goal of this therapy is consistency. You do not have to avoid blueberries, but you cannot suddenly start eating a large bowl every single day if you were eating none before. Any sudden dramatic change in your vitamin K intake can interfere with your medication and increase your risk of clotting. You must be consistent and keep your physician informed. Similarly, for my patients with diabetes who are on medications like insulin or glipizide, be aware that blueberries will help improve your glycemic control. This is a wonderful benefit, but it means your medication may become too effective. You must monitor your blood glucose closely when you begin to incorporate them consistently to prevent a dangerous hypoglycemic, low blood sugar event. For those with advanced renal or kidney conditions, you may need to monitor your blueberry intake as part of a potassium-restricted diet. And finally, for my patients who have dysphagia or difficulty chewing and swallowing, blueberries are still accessible. They can be easily pureed or gently cooked down into a soft compote, which can be safely stirred into yogurt or oatmeal, eliminating any choking hazard. The lesson here is that smart nutrition is not just about what you eat, it is about how you eat it. By understanding these simple, evidence-based combinations, you can truly unlock the profound health benefits of this food and take an active, intelligent role in your own vitality.